If the nose is not kept clean, or is subjected to increased exposure to pollutants and airborne microbes, this can heighten the chances of viruses taking hold and cause nasal congestion. Often this is seen as just a nuisance and a fact of life for many sufferers. However, for others, this can be a source of considerable discomfort. Normally, any harmful particles and viruses are trapped within the mucus and transported safely to the back of the throat. However, sometimes these viruses are absorbed into the bloodstream. This causes the body to release histamine, which causes the nasal tissues to swell and membranes to produce excessive amounts of mucus. Eventually, this swelling and increased mucus production leads to a significant reduction in the size of the nasal passages, therefore restricting airflow and making it hard to breathe. Congestion sufferers are also more susceptible to further infections because the abnormally large amount of mucus hinders the cilia from transporting harmful particles, which are consequently more likely to take hold. This is why infections of the nose and sinuses are more likely to occur after a common viral cold. One such infection is sinusitis or rhinosinusitis, which often causes a dull, pressurized headache or facial pain for sufferers. Rhinosinusitis can affect any of the paranasal sinuses, the maxillary, frontal, ethmoid or sphenoid. The condition is caused by the inflammation of the nasal linings, which results in a narrowing of the sinus openings. Typically, the nose and sinuses produce about 1.5 pints of mucus per day, so any blockages can quickly lead to build-up of mucus within the sinuses, causing pain and increasing the risk of infection. Those suffering from sinusitis or rhinosinusitis can benefit from washing their nose with a hypertonic solution, such as Sterimar congestion relief. For patients who suffer more chronic forms of sinusitis, more frequent sprays are often needed in order to help clear the sinus entrances. The unique microdiffusion spray in Sterimar helps to quickly break down the thick mucus into a thin layer, allowing the clearing system of the nose to work better. The spray also reaches deep into the nasal passages, including the sinus entrances. Sterimar congestion relief is hypertonic and therefore helps to draw out excess fluid within the nasal linings, thus reducing swelling. This enables the mucus within the sinuses to be drained away, which therefore relieves pressure within the sinuses. Sterimar can bring effective relief to many common nasal conditions, helping adults to breathe freely and easily. Although we are all unique, proper nasal function is important to us all, and we are all subject to nasal problems. This is also the case for children and babies. Little ones have a slightly different and underdeveloped nasal anatomy, so it is particularly important to ensure that their noses are working properly. For the first 6 months of their life, newborn babies can only breathe through their nose. However, the nasal passages in newborn babies are very narrow, approximately 5 to 7 millimeters wide, and the turbinate bones are proportionally very large. This means that inflammation can very quickly prevent babies from breathing properly. The nasal passages will double in size by the age of 7 and triple by the age of 15. Sinuses are poorly developed at birth, but continue to grow until their teenage years. Sterimar offers a spray that can be used to gently rebalance nasal functions, clean nasal passages of unwanted germ-filled mucus, and unblock little noses. Sterimar Baby can be used at any angle and has a nozzle specifically designed for delicate noses. It releases a low-pressure spray for extra safety and gentleness. As we can see, there is more to the nose than many people think. It has functions which are very important, especially as it serves as the first defense for the rest of the respiratory tract, as well as the ears, throat, and sinuses. A well-functioning nose should be appreciated and well looked after, and can be helped on its way by the occasional use of saline sprays such as Sterimar. Sterimar offers 3 products which are available on prescription or over the counter. Sterimar Nasal Hygiene, an isotonic solution suitable for long-period use by adults, children and pregnant women. Sterimar Congestion Relief, a hypertonic solution suitable for short-term use from 3 years of age. Sterimar Baby, an isotonic solution suitable for long-period use from birth. Sterimar, for a cleaner, healthier nose, naturally.